right. Well, here we are I'm Emily Meisen-Sebelius. I'm with Weighing In at Children's Mercy, and I am here with Atenas from our school health um, support initiative at Children's Mercy. So we are really excited to have you here today as one of our fantastic partner spotlights to hear about the great work that you all are doing to support schools throughout the school year, and especially right now with all of the various health and wellness issues that schools are really thinking about and grappling with. So we'd love for you to just share who you are. I know you're new in this role, and so we're excited to spotlight you. If you want to share who you are and tell us a little bit about this new initiative at Children's Mercy to support schools.
Yeah, thank you so much, Emily, and thank you again for having me here. I'm very excited. Again, my name is Atenas Mena. I'm the manager of school health services here at Children's Mercy, and we have a multidisciplinary team that's been working on addressing how we can better support our students' needs in school. Most recently, though, our main focus has been on COVID-19 as school reentry and how they can create a safe and healthy environment for staff and students. Our team consists of infectious disease, social and behavioral health, sports medicine, and environmental health. We are continuously checking and monitoring the most up-to-date research. That way we can provide the best guidance and support for schools.
Wow, that sounds like a lot of different expertise sort of all wrapped up into one. What a nice opportunity. What are some of the resources that are available to schools or even parents, particularly as we navigate, you mentioned COVID-19, particularly as we're navigating that as a community?
Yeah, we currently have a special section on our website with a comprehensive guide that was just developed for schools reopening during the COVID-19 pandemic. We also have a recording from a previous webinar that we had for school leaders called COVID-19 School Reentry, and other great resources for both school leaders and families on how to put on and take off a mask properly, hand washing. We even had developed from environmental health, a list of disinfectants that work against COVID-19. We also have our sports medicine team did a great job providing some guidance on how to get back into sports in the safest manner possible, and just a lot of different information. We're constantly updating this website. And for school leaders, we do have a web link in this website that's called the COVID-19 School Assistance link. And there we highly recommend, if there are any COVID-19 questions or even requests, we're happy to help answer those. We've already had various amounts of school districts submit their information and have been able to get back to them promptly.
That's terrific. So you said you have the form where school personnel can submit questions to you all. What a nice opportunity to be able to get that feedback. What are some of the questions you've been hearing so far? What are on the minds of school folks, and what kind of questions have you been getting?
Yeah, the main questions that we have been getting is trying to understand, okay, what are the symptoms of COVID-19, specifically with children? And what if someone has symptoms of COVID-19, then what do we do from school? When can they get back to school? And in general, just how can we keep our staff and students safe? And our team did a great job taking in these questions and being able to answer them through that school guidance that I mentioned earlier. And it's important to really encourage schools to have that good communication with not only their staff about the changes that are going to be implemented, but also with their students and families, so everyone is on the same page. And that is the best practice, I believe, and making sure that we're able to all follow along and be able to keep everyone safe and healthy. It will definitely take everyone's part to be able to maintain a safe and healthy environment for everyone.
Terrific. Well, we'll make sure we put a link to the website that you mentioned, as well as that form that you have available for schools, and some of the other resources that you all provided. I know you said that the recording is up of the webinar that was previously held at the end of June. So we'll make sure we link to all those below this. Are there any other places that our partners should be looking, any other resources you want to highlight for them as you're thinking about our Wayne Inn partners who are schools and also folks that support schools, health departments, and others that are really thinking about children's health and wellness?
Yeah, definitely. I mean, the web link that you all are going to provide is called Returning to School and Community Safely. So that will help cover in general the COVID-19 information that we're constantly updating, along with the link for submitting questions or concerns, requests. And then the other web link, well, the web page that we also have is the School Health Support webpage,
Okay.
and that will have COVID-19, but also other resources. We'll have a link there for 1, 2, 3, 4, 5 Fantastic and other programs that Children's Mercy currently has, or resources for school health professionals. In general, we highly relied on the guidance of CDC and the American Academy of Pediatrics to be able to provide the best guidance.
That's terrific. That's so nice to be able to have that all in one place and consolidated for everyone. You've been talking about the document with the guidance for school reopening during COVID-19.
Mhm.
What are some of the key things that our partners would find in that document?
Yeah, so the key things that you will definitely be finding are common risk mitigation
Okay.
strategies, and those will help reduce the risk of exposure. So some of those, for example, would be screening, considerations for bus rides, physical distancing, face coverings, and environmental health practices. So making sure that you're cleaning and sanitizing, mental health considerations, because this has been a rough year definitely for everyone, and
Yeah.
just a lot of different ideas of how we can help mitigate that risk and be able to reduce the risk of exposure.
Sounds like it covers quite a variety of topics.
Mhm.
At Wayne Inn, we've worked with many of our school partners and health
Mhm.
department partners and others over the years promoting physical activity at school. What sort of guidance do you have around how kids get active with these mitigation strategies? What would that look like for PE, for recess, or other ways to be active
Mhm.
during the day while also being safe and balancing that?
Yeah, physical activity is very important for Children's Mercy. We believe it's important for their students' development. And so our guidance just kind of helps give an idea for schools on how to really consider physical activity and what areas are considered safe. So, for example, definitely trying to take advantage of the outside or outdoors is very beneficial. It allows it to be easier to manage physical distancing and keeping kids apart. And other things to consider are also like how to properly sanitize equipment, especially since we're trying not to share too much, but if there's any materials that are used or sports materials, sports equipment, we want to make sure that we sanitize them between uses to make sure that everyone stays safe and we don't risk that type of exposure as well, along with hand hygiene. We
Mhm.
really want schools to keep in mind, okay, so what activities or games can students play that will keep them safe and will avoid prolonged contact time? And those are the best ones that we would recommend. For example, I can think off the top of my head is maybe a race between kids, like where they're running straight, and or just trying to do some kind of running activity, something that they can play by themselves, work on their skills on their own without having to mix too much or be too close to each other.
That makes a lot of sense. That makes a lot of sense. So those things that can still keep kids active, but also,
Mhm.
keeping safety as that high priority.
Mhm.
Um, Well, I know from talking with our patient families at Children's Mercy in a project that we were able to talk with families around healthy eating as well as food insecurity. A lot of our patient families and many in the community really rely on school lunches and even breakfasts for those healthy food access points throughout the day. Is there anything in this guidance that you all have around school lunches and how to keep that as an access point for families during the pandemic?
Yeah, we definitely want to keep that as an access point. We definitely want to encourage providing nutritional, well-balanced meals for students. And just some considerations that the schools may already be doing is that making sure that cafeteria staff or those handling food are wearing the proper protective equipment that they need. So that would be like gloves and masks, making sure they're doing proper hand hygiene. We also recommended, if it's possible, to try to have students eat in their classrooms. That way we can just help avoid having too many people in one space. It provides it to be easier for physical distancing. And if that's not a possibility, then definitely take into consideration, look around your school, see what space is large enough. I've heard of schools that have considered staggering their lunch times. So that way they have less students in the cafeteria room, and that gives them that opportunity to provide physical distancing. And another big topic has been hydration. We definitely want our kids and our staff to stay hydrated, but drinking from the water fountain may not be the best recommendation at this time. So we highly encourage schools to talk with their staff and their students about bringing their own water bottles, or other schools have also done little hydration systems or hydration stations in the classroom themselves. So again, it just helps reduce that risk of mixing too many students together and keeping physical distancing as a priority. And of course, no sharing of food, utensils, plates, all of that. The more you can keep to yourself, the better, the less you have to worry about cleaning in between as well. We really want to help schools figure out how can we keep school as normal as possible while also addressing mental, physical activity, and nutrition, while keeping in mind these risk mitigation strategies to keep everyone, in the end, we just want everyone to stay safe and healthy.
That's terrific. Thanks for sharing that. And, that hydration piece is such an important one as well. And another one that we at Weighing In have really worked with schools around ensuring that kids have that access to water throughout the day as one of those healthy beverage choices. So thanks for thinking and mentioning that as well. Is there anything else that you'd like to add when we think about how we as Weighing In and you as the school health support team can support our school and our parents too as they're grappling with decisions about what the fall is going to look like for their kiddos?
Yeah, I would say I definitely want to encourage parents and schools and Weighing In also to definitely take a look at our websites. That way you can be able to have the most up-to-date information that Children's Mercy is working on. We really want to help provide the tools and resources that the school leaders need, so that way schools can be leaders themselves and be that guide and be that go-to for parents. Every school district is going to be different, and definitely rely on your health department for guidance, and we're again happy to help with anything that needs to be reviewed or any questions that you have as well.
Great. Well, thank you so much for all the work that you're doing. Thanks for bringing together all the expertise at the Children's Mercy community and the public health community. And thanks for sharing with us here at Weighing In and Fitastic this great information for our partners. We really appreciate it.
Yeah, thank you for having me.
All right. Well, have a good day.
All right, bye.
Bye.